and start to rub lightly underneath that rib cage angle and work your way down.
Let's talk about the diaphragm, everyone. The diaphragm is a muscle, and you can see it's highlighted in pink right here. Right? I want you to notice the shape of it. It looks like a parachute, like a dome, right? It sits at the bottom of the rib cage here. And notice how it attaches down here towards what they call the lateral aspect of the rib cage. And it attaches here towards the posterior part in the back on your spine. Now, this is really important when we talk later, and I show you on the videos of things you can do to help this in relationship to how you're breathing. Expanding through the sides of the lower rib cage when you breathe and in through the back of your body around the spine as well as the abdomen is critical. And that's something that many people struggle with. We're going to go over some big things I want you to know about the diaphragm. One of the biggest ones is, what do you think sits up underneath this diaphragm here? All of your organs right here. And you'll see later when you breathe in and out, this muscle contracts and relaxes, and it actually moves the organs down here in your abdomen up and down like a piston. So it acts like a pump. It's a huge player and more than just breathing. Okay. So if you look to the side here, here's some big things I want you to understand. One, it's a huge player in breathing, and breathing is really important for your basic overall survival, but also driving the other systems of the body. If you look here at C3, C4, C5 keeps the diaphragm alive. That's a mnemonic that you learn when you start to study anatomy and physiology, where cervical 3, cervical 4, cervical 5 are bones and nerves in your neck. And then they are going to supply the motor nerve, which is the movement nerve, to the diaphragm via the phrenic nerve. So if you look at this picture here, you can see up in the neck, you've got cervical 3, cervical 4, cervical 5. They're going to branch off, and then these become the phrenic nerve. You have one on the right, you have one on the left. It goes all the way down. Look at the track of that nerve. And you see it's going to go to the diaphragm, but it also goes to part of your liver as well. So this is when people can have issues in the thorax, the rib cage, the sternum, and when people have had surgeries in the anterior region for like heart surgeries, lung surgeries, things like that. Sometimes they get damage to the phrenic nerve, and then they get a paralysis, if you will, of the diaphragm muscle. Could be the left side, could be the right side, could be both sides. That's not as common. That's going to impact the way that you breathe. But it's also why we need to look at the neck. So anytime somebody has had trauma to the neck through either whiplash injury, a slip, a fall, or they have poor posture where their head is resting really far over their shoulders, this can interfere with the function of the cervical spine nerves that feed down and through here. And then they actually have abdominal issues. They have breathing issues. They have low back pain, all these sorts of different things. And everybody chases the area that hurts down below. And they don't look up at the top because they don't necessarily feel pain in the neck. But you need to look everywhere, everyone, because the whole body is interconnected. There's no such thing as an individual part. The body is one piece. So the takeaway from this one is make sure that you look at your cervical spine if you're having any type of breathing issues or you're having any issues with your lower back or anything in your abdomen. And look here, you see where the diaphragm is actually physically attaching to parts of your spine here. It's a stabilizer of your spine. What does stabilization means? Control, right? So it's actually a really important muscle of quote unquote your core. If you have too much tension in the diaphragm or you don't use your diaphragm enough, you'll cause an issue here in your lumbar spine, and that can lead to low back pain. It can lead to poor posture. It may even contribute to people that get some herniations in their lower back because you don't have as much stability in the lower back, which means you get too much movement in the lower back, and then everything starts to wear out. One of my favorite things about the diaphragm is it moves the organs. Okay. So the organs sit up underneath here, jam packed in there like crazy. So if I'm looking at the front of the body here, This is the right side of that individual over here, and this is the left side. Over on that right side, you got the liver packed up nice and tight here. On this left side, you're going to have the spleen sitting in here, and then of course you're going to have your stomach and your pancreas and everything sitting below. But when you'll see later on the slide that every time you breathe in, this muscle contracts and it pushes the organs towards the floor. When you exhale, that muscle relaxes and then the organs bounce back up towards your neck or towards the sky. And that acts like a piston pump. So if you look here, it pumps the fluids of life. Those are your lymphatic fluid. That's basically the biggest part of your immune system. It flushes out toxins and wastes from bacteria and viruses and parasites and metabolic cellular waste. And most of your lymphatics live in your gut. Imagine that. It's going to move what's called your glymphatic. That should be a G there. The glymphatic is the waste management drainage system of your brain. Okay, so they're glymphatic. And cerebrospinal fluid. What's the cerebrospinal fluid? Well, cerebro means brain, spinal is spine. That's the fluid that surrounds your brain, and also the spinal cord and the spinal nerves as they're coming off. And then, of course, it's going to move the blood. How does it do that? Through pressure. It's a big, big player in helping vein flow move, venous flow. Now, when you understand that you have twice as many veins in the body as you do arteries, I'm going to say that again. You have twice as many veins as you do arteries in the body. That means breathing should be important because you don't want stagnated vein blood. That's going to end up causing a problem down the line for you in pain somewhere. You can trust me on that one. And it's a big thing with pressure control. So every time that you cough or sneeze or try to do a poop, defecation, you're actually going to be influencing this particular region here. And it also gives you the ability to brace yourself when you're training or working out or trying to get some core stabilization. All right. So it's a huge player, everybody. And most people will have some type of issue with their diaphragm muscle because they don't even know it because they're too busy breathing from the neck too much, the lungs too much, and the chest too much. Most of your breathing should come from down below. Now, this is from Thomas Myers' Anatomy Trains book. And this is called the deep core line. So take a look at this. This is quite fascinating. So fascia is basically connective tissue in the body. It wraps around everything like a cellophane wrap. Everything in your body is connected. What I want you to look at here is the diaphragm. See the diaphragm up top? Look at all the other stuff that's going to influence here, all the way up to the tongue and the lungs and the neck, down here in through the psoas major muscle, which how many people have heard about a tight psoas muscle that contributes to back pain? The adductor group, which is the muscles along the inner thigh, the knee itself. So maybe you have knee issues that are not coming around. Look at the diaphragm, right? The deep compartment of the calf muscle. Now that's important for vein flow and blood flow and lymph flow from the feet and all the way down to your feet, your toes, the muscles of your feet. Now, that's when you have better breathing, you get better foot control. When you have better foot control, you have better breathing. It goes both ways. So what's the takeaway here? If you're having issues in any of the parts of the body that you see here, treat that area, of course, but then I want you to go and do what you're going to learn here in a moment with the diaphragm reset. Let's go over some basics of breathing. A great, great picture of the diaphragm muscle. So I'm looking anterior at the body. This is your sternum. And this is your right side over here. This is your left side over here. You've got a right dome of the diaphragm. You got a left dome of the diaphragm. What do I want you to notice here is that the right dome is higher than this one. Why? Because the liver is stuck up underneath that thing. And the liver is ginormous. It actually comes all the way over to the other side. Okay, so you have a right diaphragm, you have left diaphragm. They should be working together. Each one is innervated by the phrenic nerve. Okay, and then take a look at how this attaches to the lumbar spine right here. That's called the crus of the diaphragm. But that's going to, every time you breathe in and out, you're going to see in a moment that muscle contracts. It actually pulls like a little tether. Okay, and that holds and moves and stabilizes this lumbar spine area, this transition area from your thoracic spine to your lumbar spine in that region. Okay. And then look at the lateral margins of the rib cage here, the outside margins. This part of the rib cage out here is when many people just get stuck. They don't have good awareness of this part of their rib cage. And we want to highlight that. And that's why we're going to do some work here. And we're going to free the tension of this diaphragm muscle from underneath the rib cage by hand. And then we're going to do a little bit of breathing. Now, let's look at the motions of breathing, the mechanism of breathing. Pretty simple. You're going to breathe in, and we're going to teach you to breathe in through your nose because that's going to give you better movement of your diaphragm automatically, and it's going to deliver more oxygen to the lower 1/3 of your lungs here as opposed to breathing in through your mouth. So when you breathe in through your nose, you increase pressure here, and then the diaphragm muscle contracts. And when it contracts, it pushes the organs down towards the floor or toward your pelvic area. Okay. So pressure increases. Now, I want you to notice what happens here when you exhale. So when you breathe out, either through your nose or through your mouth, you can choose either one, whatever one you like. The most important in my world is going in through your nose, out is up to you. Okay. I like the mouth because people can typically have a longer exhale through their mouth. And what you'll notice is that now the diaphragm muscle relaxes and the pressure here goes down. Pressure allows the organs to move back up. Okay. And then you repeat that over and over and over, like 20 to 25,000 times a day. That's a lot of pumping in there. And that's going to get all this motion and movement down in your abdomen. Now, look at the rib cage here. This is your sternum. I want you to see what happens. When you breathe in, your sternum actually goes out and up. And it looks like this. It's called bucket handle breathing, right? So this is your sternum. These are your ribs. This is your spine. And when you breathe in, it's like taking a handle pump on a well and it comes up like this. And then when you exhale, it comes back down. Right? Handle goes up, handle goes down, handle goes up, handle goes down. So what happens if you have a lot of restriction in the sternum? You have tightness in this part of the rib cage from poor posture. Well, your pump handle doesn't come up as far. And if your pump handle doesn't come up as far, guess what? You can't get a full contraction down below, full inhalation here, over and over and over. And then so in actuality, you're starving your body of much needed oxygen, but also of range of motion. Now, you remember when we talked before about the rib cage here? When you breathe in, it goes sideways like this. It actually goes out and up, out and up, out and up as the front sternum goes out and up. And it looks like this. So if I'm viewing you from the front again, there's the sternum, there's the spine, these are the ribs. So they call that bucket handle movement. Like this handle of a bucket. When you breathe in, it comes out. When you breathe out, it comes down. Here, 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 here. Up, down, up, down. And what you can't forget is what happens in the back part here. So when you breathe in, okay, the ones on the side go out. The abdomen in the front goes forward. And you also need to have movement posterior, which means the back part that attaches to the spine needs to go backwards. And that's called 360 breathing. So in essence, if I'm looking down on the diaphragm, you need to expand the diaphragm to the front, to the back, and then to the sides like a big giant circle like that. Okay, so it's more than just belly breathing. Belly breathing is good, but you need to make sure you do more than that. And that's what we're going to end up teaching you here when we show you the two things I want you to do next. Okay. So let's move on into the video and I'll go over how to do this to yourself and let's rock and roll.
Lie on your back, bend your knees, put your feet flat. You can do it on the floor, a table, or the bed, whatever's more comfortable for you. This is going to relax that abdominal region. I encourage you to place something underneath your head to support your neck so it's easier for you to breathe. And I don't want you to have any neck pain or discomfort when you do this. Okay, let's orient you to where you are. Right here is the top of the what's called the rectus abdominis muscle. It sits right below the bottom of the sternum, and then the rib cages angle off like this, and they come on down, just like the pictures that you saw. And the diaphragm sits right here. Remember, it's going to attach to the sides of the rib cage and then the spine in the back. Now, underneath this rib cage margin here, it can get tight and tense from poor breathing, poor posture, just life in general. And when that gets tight, the connective tissue fascia underneath there can cause an issue with how the organs move and how the diaphragm moves, because this is the right side, this is your liver side, and this is that spleen side, pancreas, stomach side. What you're going to do is this. You're going to lightly massage underneath that margin of the rib cage all the way down to the bottom of the ankles. A few ways that you can do this. You can take one hand on either side, come up at the top below the angle of the sternum, and start to rub lightly underneath that rib cage angle and work your way down. When you find spaces that are really tender or tight or have a lot more tension, stay there for a moment, massage them out. Don't stop breathing. If you experience pain, I want you to lighten up your pressure, go easier. Nothing should hurt when you do this. Hopefully, it'll ease up in time. Then work your way back up. Okay? There's no magical amount of time to spend on here. It's whatever you feel comfortable with. You can also do one side at a time using both hands, coming up underneath. So it feels just a little bit of a different sensation now because I can come further up underneath that angle. And you'll notice a difference when we show you the breathing exercise in a moment when you free this area up, because this area typically has a lot of tightness and restriction in it. Now, one of my favorite things to do is this. If you take one leg and you cross it over the other like this, so my ankle is on top of the other knee, and all you're going to do is let your legs fall to the side. They're going to fall to the foot side. So I'm going to fall to the left, and then that foot, my right foot, is going to be flat. So here I'm opening up my right side and I'm getting a nice stretch on this tissue. Then I'm going to put my fingers underneath the right side like this. Man, that feels really good. Massage a few times. Okay. Then I want you to bring your legs back up. Really nice stretch for your oblique muscles too. Then I'm going to switch my legs. So now my left foot goes over the top of my right knee. I'm going to fall to my right. So that foot's going to go here. And then the left side opens up. So now put your fingers underneath here. You may notice a big difference between one side and the other side. So for me, my left side is tighter. So I'm going to spend a little more time there. And that's because these oblique muscles that sit right here can become imbalanced from one side towards the other side. And then you come back up. Just do one repetition either way. And that's it. Now we're going to concentrate and work on the breathing exercise that I want you to do. All right. Now, remember, we talked before about the diaphragm is going to kind of open up like a balloon when we breathe in. So here's what I want you to focus on. We're going to close our mouth, breathe in through the nose. And when you do that, I want you to to focus on the abdomen going out, up towards the ceiling. But I also want you to focus on the sides of the rib cage down here, the lowest parts going away from each other this way. And the hardest part is imagining the lower back, this part of the back, expanding, going in towards the floor. So when you expand all of those together, it's like this open balloon. Easy way for you to feel that is to place your hands on the sides of the lower rib cage. Close your mouth, breathe in through your nose. When you breathe in through your nose, I want you to try to expand the ribs so they go away from each other. Like that. And when you concentrate on the ribs going away from each other, the stomach and the back part will naturally move on their own. And pay attention to this. Do you feel one rib cage moving faster or further than the other side? Or are they even? Or are they both not moving that much? Watch me do a couple of repetitions and you look. So what I want you to focus on is this. See if you can expand them together at the same time. Now, if you notice one side moves more than the other, I want you to focus on your next inhale on trying to put more into the side that's not moving as much. So then what you'll notice is you'll start to get a slight improvement in there because you have more awareness in relationship to your breathing. And that's why we want to free up this rib cage first to open up this tissue so these areas can expand together and open up that diaphragm abdomen region to help the pump in the abdomen, move the lymph flow, move the blood flow, and stabilize the lumbar spine. Check that out. Do it every single day. Let us know how it goes.